In this presentation, I'm going to give you a brief overview of the feline allergic diseases, focusing especially on skin diseases, and then I'm going to give you the reasoning behind the development of the proposed new nomenclature. So if we first consider as background the characteristics of feline allergic skin diseases, we know that the cat can develop allergic reactions to insects, particularly fleas, to foods, and to environmental allergens. Feline allergic skin diseases generally present with one of four main types of reaction patterns, namely miliary dermatitis, self-induced or barbed alopecia, head and neck pruritus, and the eosinophilic granuloma complex. Indolent ulcer, linear granuloma or collagen-lytic granuloma, as it's often called, and the eosinophilic plaque. Cats may present with a combination of reaction patterns, and no one reaction pattern is associated with any particular allergic condition. Unfortunately, these reaction patterns are not specific for allergic reactions, and the same reaction pattern can develop as a result of a variety of non-allergic conditions, which makes a precise diagnosis very difficult. So the first of the reaction patterns is miliary dermatitis, which is the most common, and this actually can be a presentation of dermatophytosis, obviously of non-allergic origin. And the lower slide is from self-induced or barbed alopecia, where there are shorn-off hairs, and you can verify this by plucking hairs and looking at them microscopically. And often this involves the belly area and leading to so-called ball belly syndrome of the cat. And this is head and neck pruritus. And in this slide, we have examples of the eosinophilic granuloma complex. On the top left, we've got linear granuloma before and after clipping the hair away, where you can see beautiful linear reactions, which are quite symmetrical in this case. And the bottom slide has varicose proliferations, which are sometimes seen in the pharyngeal region of animals associated with this condition. And linear or collagen-lytic granuloma can also involve the lower lip area, manifesting as swollen chin. And on the top right, we have the indolent ulcer, and in the bottom right, we have the eosinophilic plaque. But the cat also suffers from allergic conditions affecting other organs, including the respiratory tract. Feline asthma, a high proportion of cases now are believed to result from allergy, and there's a very well-defined experimental model which has thrown a lot of light on this condition, and it shows similarities to human asthma. Cats exhibit dyspnea with expiratory wheezing and chronic cough. They can manifest upper respiratory signs of rhinitis and conjunctivitis, and allergies can affect the gastrointestinal tract, leading to gastritis, gastroenteritis, and/or colitis, manifesting as flatulence, vomiting, or diarrhea. Important to note that cutaneous and non-cutaneous signs may occur together and in random associations. So you can have a cat with asthma that also develops allergic dermatitis. Similarly, environmental food and flea allergy may occur in the same cat and with random associations. And although the terminology pertaining to flea allergy and adverse foods reactions is non-controversial, there has been a lack of consensus in respect of environmental allergies, with a number of terms used in the webinars presented in this series, including atopy, atopic dermatitis, atopic disease, and non-flea, non-food hypersensitivity dermatitis. So some of the webinars in this series came out before the introduction of the new proposed terminology. And this area was a subject of investigation by the International Committee on Allergic Diseases of Animals, or ICARDA. A working party comprising 8 members of this group was charged with reviewing the relevant literature and making recommendations regarding terminology. And the salient questions were: how many, if any, of the feline allergic diseases can be classified as atopic? And 2, to what extent can the terminology pertaining to the canine and/or human allergic diseases be used in describing the feline entities? We first got to ask, what are the features of an atopic disease? Well, the term atopy and atopic disease was introduced by Coker and Cook in the 1920s and 30s to describe 3 allergic conditions of man, namely asthma, hay fever, allergic rhinitis, and atopic dermatitis. And atopy, the term atopy, is after the Greek, meaning strange disease. There were familial tendencies they recognized indicating a genetic predisposition, and they were associated with the production of what came to be known as IgE antibody. And the accepted definition of an atopic disease was a familial predisposition to allergic disease affecting the skin, respiratory, and/or gastrointestinal tract. However, not all cases were associated with IgE, leading to the definitions of extrinsic or allergic and intrinsic or non-allergic diseases. There was a tendency for 2 or more of the conditions to occur in the same patient, and this may develop sequentially over time, the so-called atopic march. So we may have a child developing atopic dermatitis at the age of 4 or 5 and going on in the teenage years to develop allergic asthma or rhinitis. So in this chart, we ask the question, to what extent do the dog and cat satisfy the criteria as manifesting an atopic disease? And the strength of the evidence and the frequency of the condition is indicated by the number of ticks in the relevant box. So if we look at asthma, certainly the cat develops asthma, as we've already mentioned. The dog does not develop asthma. And in the cat, there is certainly some evidence of the association with IgE antibody. Upper respiratory disease can occur in the dog and the cat associated with allergic reactions. And there's again some evidence, although not strong evidence, of association with IgE antibody. So in this case, we only get 1 tick in the box. If we look at dermatitis due to environmental allergens, of course, this is atopic dermatitis of the dog, very common and very well characterized. If we look at the feline condition, not quite as well characterized, but certainly very common. If we look at association with IgE antibody, yes, in the dog, there's for many years been good evidence of the association of atopic dermatitis of the dog with IgE. And there is evidence emerging in the cat of association with IgE antibody, but it is not yet as strong. Is the dermatitis consistent with human atopic dermatitis? Absolutely in the dog. Absolutely not in the cat. It is neither clinically, nor histopathologically, nor immunologically suggestive of human atopic dermatitis. Quite different. Is there a genetic predisposition? Yes, in the dog. And in the cat, there is some evidence of genetic predisposition. In almost every case series that have been published, a predisposition for the Abyssinian breed has been shown, and there have been individual case reports of families of cats being affected. Is there existence of adverse food reactions in the species? Certainly in the dog and certainly in the cat, although perhaps less common than in the dog. And quite controversial is the association with IgE antibody. but there is certainly evidence in both the dog and the cat of association with that antibody, although looking for that antibody is of no value from the diagnostic point of view. Do two or more conditions occur in the same patient? Yes, that certainly can occur in the dog, and it certainly can occur in the cat. So you can have asthma and you can have dermatitis. And in the dog, you can have food allergy and you could have environmental allergy. Are there intrinsic and extrinsic variants? Yes, in the dog, but this question is unresolved as yet in the cat. There is no evidence in either species of an atopic march. So if we look down the columns, certainly the dog is pretty strong. There's good evidence of atopic diseases. In the cat, the evidence is perhaps less strong, but there's enough evidence, I think, to suggest that we can consider that the cat is predisposed to atopic diseases, but perhaps less so than the dog. So major conclusions from these considerations: there exists in the cat an atopic state, and the term feline atopic syndrome, or FAS, is proposed as an umbrella term. Although the dermatitis resulting from environmental allergens exists within the cat, and with some evidence of the involvement of IgE, the clinical and histopathological signs are so completely different from man and the dog that the term atopic dermatitis is inappropriate, and so the term feline atopic skin syndrome, or FASS, is proposed. Other conclusions: as food reactions resulting from non-immunologic etiologies have never been unequivocally demonstrated, the term food allergy is recommended as an etiological term, and the term adverse food reactions should be abandoned. And finally, although flea allergy dermatitis can mimic and or contribute to FASS, as insect hypersensitivity has never been considered as an atopic disease in man or any species, it should not be considered as such in the cat. So if you look at our definitions, feline atopic syndrome, or FAS, this description encompasses allergic dermatitis associated with environmental allergens, food allergy, and asthma that may be associated with IgE antibodies. Food allergy and flea allergy can both either mimic and or contribute to this syndrome, and their potential role must be assessed before deciding on the therapeutic approach. Feline atopic skin syndrome, or FASS, is an inflammatory and pruritic skin syndrome of cats manifested by a spectrum of reaction patterns, none of which are specific for this syndrome, and that may be associated with IgE antibodies to environmental allergens. Food allergy and flea allergy can both either mimic and or contribute to this syndrome, and their potential role must be assessed before deciding on the therapeutic approach. And going on with definitions, feline asthma is an eosinophilic inflammatory disease affecting the bronchioles and leading to reversible bronchoconstriction and airway remodeling, manifested by acute respiratory distress or chronic coughing and expiratory wheezing, and that may be associated with IgE antibodies to inhaled allergens. We look at intrinsic and extrinsic diseases. The definitions applied to FASS and to feline asthma do not preclude the possibility that extrinsic and intrinsic variants may be later defined. Extrinsic associated with IgE antibodies, and intrinsic in which no such association will be demonstrated. And this is analogous to atopic-like dermatitis of dogs, which is not associated with IgE antibody. And feline food allergy is an etiologic diagnosis referring to any clinical manifestations, including those of FASS, that are attributable to immunologic reactivity to an ingested food item. Finally, I leave you with the bibliography. There are 4 papers that were published in the Journal of Veterinary Dermatology. The first dealing with the proposed nomenclature, the second dealing with the immunopathogenesis of the feline atrophic syndrome, the third with the clinical signs and diagnosis of feline atrophic syndrome, detailed guidelines for a correct diagnosis, and the final one, the treatment of the feline atrophic syndrome, a systematic review.